Welcome to all. I am Dr. Vasant and today we'll see on carbon monoxide toxicity. Carbon monoxide is formed during the incomplete combustion of any carbon containing compound. It is odorless, colorless and tasteless. That's why it is difficult to detect in the environment present. So before going towards this carbon monoxide toxicity, we should think whether we are exposed to carbon monoxide at all, because we drive vehicles in road and we have kitchen in a house. So the smoke either from the kitchen or from these vehicles can contain this carbon monoxide. Since it is odorless, colorless and tasteless, every one of us can get exposed to it. So that's why around 230,000 probable cases are loaded annually in the US. So these are the sources of carbon monoxide. It could be right from the charcoal grills, coffee roasting, from fires, from wood pellets. But I want you to concentrate on these. These are usually used in our daily activities also. These are the generators, power washers, boat, car, trucks, water heaters, ranges, ovens, everything. So all these apparatus can let out carbon monoxide. Why should we know about this? As we already know, carbon monoxide can cause type 1 respiratory failure and HBO is a best therapy for it. But all these is for the acute point. We need to concentrate more, we need to read and we need to educate ourselves on a delayed presentation. That is the most serious complication, the persistent or delayed neurological sequelae or the delayed neurocognitive sequelae. It can occur as much as 48 to 50% of patients with symptomatic acute poisoning. So let us see on this first. Having said that, the normal levels of carboxyhemoglobin is 0 to 5%. So why are we reading on this cognitive sequelae? So there are studies comparing patients treated with hyperbaric oxygen therapy and patients who are not treated with hyperbaric oxygen therapy. You need to understand that even if you treat a patient with hyperbaric oxygen therapy, 24% of the people had cognitive sequelae at 6 weeks. And 17% of people had cognitive sequelae at 6 months, and around 14% of people had cognitive sequelae at 12 months. So even if you treat a patient with HBO, the patient can still develop cognitive sequelae. But you can see there is a good improvement compared to people who are not treated with HBO. That is 42% at 6 weeks, 30% at 6 months, and 18% at 12 months. Toxicokinetics. Carbon monoxide, once inhaled, it readily gets absorbed. So the Coburn-Forstner-Kane model can predict the amount of carboxyhemoglobin levels based on the exposure history. So this is your Coburn-Forstner-Kane model. It tells you that the carboxyhemoglobin percentage is equal to 100 by 1 plus 643 by parts per million of carbon monoxide at that environment. So this is with an exponential uptake. It takes more than 4 hours for equilibrium to be attained. Okay, so once you are exposed to carbon monoxide in a particular environment, it takes around 4 hours for that particular carbon monoxide to get equilibrated inside your body. So this Coburn-Forstner-Kane model tells you about the post-equilibrium status of carbon monoxide. What I am trying to tell is, if you are exposed to a very high concentration of carbon monoxide, even before 4 hours, the high toxic components can be present in your blood. So this Coburn-Forstner-Kane model is only for after equilibrium, that's after 4 hours. Acute severe exposure of carbon monoxide cannot be calculated by Coburn-Forstner-Kane model. So after its absorption, this carbon monoxide is carried in the blood, primarily bound to hemoglobin. So the Haldane ratio tells you that the hemoglobin has approximately 200 to 250 times greater affinity for the carbon monoxide than the oxygen. And moreover, 15% of this carbon monoxide is bound to the myoglobin. So myoglobin is 60 times favoring more carboxyhemoglobin, carbon monoxide than the oxygen. So you need to understand that carbon monoxide, when it gets attached to the hemoglobin, it affects the hemoglobin delivery and the oxygen delivery to the tissues. The remaining around 15% which is getting bound to the myoglobin tells you about the tissue bound stuff. So therefore, the dissolved carbon monoxide concentration in the plasma better reflects the ultimate potential for poisoning rather than the carboxyhemoglobin values. Elimination. There were studies conducted with volunteers who attained carboxyhemoglobin level of 10 to 12%. In such people, the half-life was 248 to around 320 minutes in room air, and when you administer around 100% oxygen in an environmental atmosphere 1 at ATM, it is 47 to 80 minutes. In patient poisoned in a higher dose of carboxyhemoglobin, the half-life will be around 74 to 131 minutes with the treatment of 100% O2. So having said all these minutes calculation, you need to understand this is a pain stripper. It contains methylene chloride, and the half-life of the carboxyhemoglobin attained because of methylene chloride is going to be different compared to the inhalational route. So this methylene chloride is readily absorbed through the skin or by ingestion or inhalation. It is metabolized in the liver to carbon monoxide. The peak is around 8 hours. The half-life is going to be at 13 hours. So the carboxyhemoglobin levels after methylene chloride exposure are proportional to the concentration and duration of exposure. What I'm trying to say is, in otherwise by inhalational route, if you're treating a patient in 4 to 6 hours, here in methylene chloride poisoning, you need to treat the patient for minimum of more than 13 hours. Okay. So a good history is more important before treating the patient. So pathophysiology. This is the oxygen dissociation curve. You can see that this is the normal dissociation curve, and the carboxyhemoglobin will push this curve towards the left. So pushing the curve towards the left decreases the oxygen delivery to the tissues. So what all can shift this curve towards the left? Methemoglobinemia, decrease in temperature, and alkalemia, and decrease in 2,3-bisphosphoglycerate, all these things. So along with this, the carbon monoxide also shifts this carboxyhemoglobin